If your neck feels tight, stiff, or sore, this simple taping method can help provide a lot of relief. Kinesio taping isn't just for athletes on the sideline. When applied correctly, this kinesio tape method can help ease your neck pain, speed your recovery, and help improve your mobility. In this simple taping method, I will show you the exact 3-step taping application that I've used literally on thousands of patients, helping them to reduce their neck pain and improve their neck mobility. Be sure to watch to the end and I'll show you one bonus taping application that's designed to help relieve neck pain from a herniated disc, such as a very common C5, C6 disc herniation. My name is Dr. Marc Dupuis. I'm a corrective care chiropractor in Sanford, Maine. On this channel, you will learn tips and strategies on how to improve your posture, your spinal health, so you can move better, feel better, perform better, and have overall better health. If you've ever woken up with a stiff neck, you just can't bend, turn the right way, or when you're driving and you're trying to look over your shoulder and your neck is just not moving the way that you would want it to move, you're not alone. Many people deal with chronic neck pain, chronic stiffness, and most people have tried some of the common things that people run to when they first have these symptoms, such as ibuprofen. They might try some heat or some ice or some Tylenol. But many times what happens is because they're not addressing the underlying cause, they find these symptoms of neck pain, stiffness just keep coming back over and over again. If you want to try something that can actually help support your tight neck muscles, reduce inflammation, and actually help you to move better, this is where kinesio taping can help. But first, before we dive in, what exactly is kinesio tape? So there's many different brands out there, but most kinesio tapes, you have similar properties among the different brands. So kinesio tape basically is a flexible cloth-like tape. Most people aren't aware that it does come pre-stretched onto the backing. And then what's really neat about kinesio tape is depending on how you apply it, whether you start at the origin of a muscle or at the insertion and apply it towards the insertion or towards the origin, it can have different effects. You can actually apply kinesio tape in such a way where you can help to ease hypertonic or spastic muscles. You can actually decrease the tone of those muscles. And you can also help, there are ways to apply the tape to facilitate or help a muscle that may be stretch weakened, help it to activate so it does its job better. And you can also apply the tape in a way to provide some lift on the skin that can actually help to open up the lymphatic vessels that are close to the skin, and that allows the body to resorb areas that have excessive swelling. So there's quite a few different applications depending on how you put the tape on. That's why I'm going to go through my specific 3-step tape strategy for one of the most common ways to support the neck for chronic neck pain, chronic stiffness, and decreased mobility. Okay, first we cut 2 strips of tape, and when you look at the person that we're applying, we're going to be applying from the shoulder. We're going to be going up the trapezius muscle towards the base of the neck. So we're talking about pieces about this long for this individual. I always like to round the edges of the tape. If there are corners, they might catch on fabric more often. So what we do, as Autumn's showing us, we're going to look down and then turn away to pre-stretch this tissue. As I said, tape is pre-stretched, so this is how we free the tape off the backing. And the start of the tape and the end of the tape, we don't want there to be any tension, so that kind of frees up the pre-stretch. I'm going to go underneath the straps as an anchor. Most kinesio tape is heat activated, so when you put it on, you'll give it a bit of a rub to activate the glue. And then this is the key part. We want about 50% of stretch, not 100%, about 50% of the stretch. And I'm going to go right up the trapezius, and then the last little bit I leave without any tension on the tape. I rub that down. We can bring her back to neutral. And then we're going to do the same thing here. We're going to look down, look away. Right there. I'm going to free up the end of the tape. Off the backing, I'm going to anchor that right under our straps here. We're going to activate the glue. We're going to go about 50% of tension up the trapezius. We're going to put the last part down without any stretch. We're going to activate the glue, and that's providing some good support. And then the last strip that we apply is for general tension at the base. We're going to find the bony spine, and I come right to where the neck meets the upper back. And for this strap, I'm going to tear it down the center, leave a couple tabs like this, and I'm going to go maximal stretch. I'm going to put that down, then we're going to lightly lay down the other end. So there you have it. That provides some good general stability. We're going to help to reduce any inflammation in that area, and that can help to improve mobility as well by ensuring that her tissues or joints are in a better approximation or joint position to move better. Okay, now for the bonus taping application. This taping application is for someone that has neck pain that's due to a herniated disc. C5, C6 is one of the most common levels that are herniated. Most people have heads that translate forward, and that drives more pressure on the lower cervical spine. So I cut 2 smaller pieces of tape, and we're going to make an X marks the spot full stretch application over the interspace of where that disc is herniated. So, for example, let's say C5, C6, where her AC joint is, this is the approximate location of T2, T1, there's 12 thoracic vertebrae, C7, C6, so 5, 6 is right here. So what we're going to do is we're going to have Autumn look down, and I'm going to pull right in the middle, break the paper on the tape right in the middle. Similar to what we did for a lumbar disc, but only using 2 pieces. I'm going to go maximal stretch. Put those tabs down, the end tabs without any tension. We activate the glue. Same thing, we're going to go tear the paper in the middle. We're going to go maximal stretch. We're going to go X marks the spot. And what that will do will really provide some support right in that area of the spine where the herniation is occurring. That can really help to slightly elevate the skin, open up the lymphatic vessels, help pull out some of that excessive swelling or edema. And then from this position, you could do then the first tape application to provide more general support. You now know how to apply kinesio tape to decrease neck pain, reduce stiffness, and help improve neck mobility. I hope you received some value from this video. Please like it and share it, because you may be able to help others that are suffering with chronic neck pain, neck stiffness, neck mobility issues. Remember to subscribe to this channel if you want to make smarter, better informed decisions about your spinal health and general overall health. And also, the next video you should watch is how to fix your neck after whiplash car crash injury.